So let us start the another theory part, and the title is the drug used against the protozoa or anti-protozoal drug. So today I am going to discuss about the anti-protozoal drug. So in this so first we have to know about the what is the meaning of protozoa. So as we know, the protozoa is a unicellular organism, and interestingly, the important point is that it is very difficult to eradicate the protozoa. What is the reason? Reason is simply because it is transmitted by the ticks, flies like CC flies, mosquito, and other arthropods. And because of that, the protozoa are rather very tough to eradicate or eliminate. So, other important point regarding the protozoa is it is a genetic importance disease. So this is one more important point regarding the protozoa. And there are various protozoal infection of the veterinary importance are amoebiasis, giardiasis, trypanosomiasis, ehrlichiosis, babesiosis, theileriosis, anaplasmosis, trichomoniasis, coccidiosis, and so on. We already discussed earlier regarding the anticoccidial drugs. So today in this class, I am going to discuss about the drug which act against the trypanosomiasis, also ehrlichiosis, ehrlichiosis, babesiosis, theileriosis, anaplasmosis, and some against the leishmaniasis and cytauxzoonosis. So this much of drug we are going to discuss in today's class. Regarding anti-pyroplasm is concerned, anti-pyroplasmic drug is concerned. So first we have to know about what is the pyroplasm. So simply pyroplasm in which the protozoa is coming, which include Babesia, Theileria, and Cytauxzoon. So these three species are included in pyroplasm, and that is transmitted by the ticks. So first we have to discuss about the drug which act against the trypanosoma is called anti-trypanosomal drug. So first we have to define again anti-trypanosomal drug are the drug that are going to kill or eradicate trypanosoma from the host is called anti-trypanosomal drug. Regarding trypanosoma is concerned, it is a flagellate protozoa, and this flagellate trypanosome is residing in blood, tissue fluid, and some of the tissues of the vertebrate animal. Now we already discussed about the definition of anti-trypanosomal drug. Now we have to discuss about the classification of the trypanosomal drug. So this classification in continuation of the anticoccidia or anthelmintic, their classification is also based upon the chemical structure. So classification of anti-trypanosomal drug is based upon the chemical structure, and we have to discuss one by one. Like aromatic diamidines, aromatic diamidines or simply diamidines, Under the aromatic diamidines, the example are diaminazine diaceturate, phenamidine isothionate, propamidine, pentamidine isothionate, and stilbamidine. In these all the drugs that two are of human trypanosomiasis importance are pentamidine isothionate and stilbamidine. So these two drugs are of human trypanosomiasis that we are going to use for the treatment of the sleeping sickness, and that we call it the African trypanosomiasis. The second one group is quinapyramine. So quinapyramine is coming in the market with two salt, quinapyramine chloride and quinapyramine sulfate. So chloride is used particularly for prophylaxis against the trypanosoma, whereas sulfate is specifically used for the therapeutic purpose of trypanosoma. So this is about the quinapyramine compounds. Now next is aminophenanthridium compound. Under this aminophenanthridium compounds, the example are homidium, isometamedium, pyrithidium, dimedium, and ethidium. Quinapyramine compound that we already gone through the example, as well as the aminophenanthridium compound, both are used to treat the trypanosomiasis for treatment that we call it curative, as well as the prophylaxis purpose. No doubt the another example belongs to another chemical group, carbamide derivative. The only one drug that we are still using, that we call it the suramine, that the suramine is also used for both therapeutic or curative purposes as well as the prophylactic measure for the trypanosomiasis. Next two, or you can say the three group that we are not using nowadays because we have more option of better or safer drug, then therefore we are not using the drug that belongs to either group like antimonial compounds, then dyes, then arsenical compound because of its low safety of margin. So from antimonial compound for the trypanosomiasis, the drugs are tartarimetic, that is simply the antimony potassium potassium tartarate, and estibofen. Whereas the dye that we are using as a trypanosomiasis treatment is trypan blue and the trypan red. But the problem with this is the drug that we already mentioned. The drug is possessing lower safety of margin, as well as this drug also stain the milk. The last one under the classification of group is arsenic compound. So we call it arsenical compound. The example is melarsomin and melarsoprol. So now we have to discuss about the drug in detail, about the dose and the mechanism of action that we are going to discuss, and the side effect and other thing that we are to discuss separately one by one. So first is the aromatic diamidines. So this under the aromatic diamidines, the most usable drug is diaminazine diaceturate. Also, we are using phenamidine isothianate, but first we have to discuss about the diaminazine diaceturate. So the drug is used to treat the trypanosoma, so we call it anti-trypanosomal drug, and also the drug diaminazine aceturate is acting against the Babesia. So anti-Babesial drug diaminazine diaceturate. But the problem with this diaminazine diaceturate against the trypanosomiasis is that this diaminazine aceturate or diaceturate, that is if the parasite, that we have to discuss later on. First we have to go through the mechanism of action. So diaminazine diaceturate get concentrated in the parasite, and when it reach in the trypanosoma, because of its concentrated form in the trypanosoma, it bind rapidly with the DNA, and the binding is irreversible binding. So diaminazine diaceturate or aceturate is get concentrated in the parasite trypanosome and bind irreversibly with the DNA, and therefore because it bind to the DNA, so it will inhibit or interfere in the DNA formation, and therefore it hinders the parasite replication. In addition to that, as we earlier discussed, the majority of the anti-protozoal drugs are targeting the energy system of the parasites or protozoa. So similarly, diamidines or diaminazine diaceturate is also inhibiting some enzyme as well as the protein, and therefore it interfere in the ATP generation, that is the aerobic glycolysis, as well as it also hinder the function of polyamines in the parasite trypanosoma. And that way the drug diaminazine aceturate or as a group diamidines are acting against the susceptible protozoa trypanosoma. First, it bind irreversibly with the DNA, so it hinder the DNA formation and parasite replication, as well as it interfere the energy generation by inhibiting the enzyme as well as the protein, and thus it interfere in aerobic glycolysis, and finally the ATP generation is get interference, as well as in addition it also affect the function of polyamines of the susceptible parasite trypanosoma. So this is about the mechanism of action of diamidines. Now we have to go through the drug diaminazine aceturate or diaceturate. This is one of the most usable drug for trypanosomiasis. So this one is the widely used drug, and the color is yellow powder. So as we already discussed about the mechanism of action, it binds to the DNA irreversibly. So where are the places the DNA are present in the organelles present in the cytoplasm of the susceptible protozoa? It will affect the DNA formation. And the ratio of binding of the drug with the DNA is about one molecule of the drug diaminazine aceturate bind with about 4 to 5 nucleotide or nucleotide. So this is about the binding one molecule of the drug with the 4 to 5 molecule of the nucleotide. So this is about the mechanism of action. Now we have to go through the anti-protozoal activity of the drug diaminazine aceturate. Regarding this diaminazine aceturate is concerned, we already discussed the drug is act against trypanosoma as well as the Babesia. So anti-Babesiosis as well as the anti Trypanosomiasis. Regarding Babesia species is concerned, Trypanosoma vivax, Trypanosoma congruens are good sensitive with the drug, whereas the one more species, Trypanosoma brucei, is less active. The drug diaminogen aceturate is less effective against the species Trypanosoma brucei. So therefore, what we are going to do, to combine the drug, and that combined drug should possess the good activity against the brucei. So therefore, it give rise to synergistic effect. So we have to discuss it later on. So here, interesting about the diaminogen aceturate is that acting against trypanosoma, acting against babesia, as well as acting against the bacteria like brucella and streptococcus species, and possessing the cidal activity, that is the killing effect. So interestingly, the drug is not only going to kill the protozoa but also going to kill the bacterial infection of brucella and streptococcus species. Parenteral administration is better absorbed as compared to the oral absorption. But what is the problem with this drug is that the drug is producing local reaction at the site of injection, particularly in the equine. So in case of equine, it leads to the hypoglycemia as well as the local reaction at the site of injection. And because of this region, we are going to apply the drug at two or more site, or we are going to apply this drug by using some other component which reduce this local reaction or pain or inflammation. That here is the example. Diaminogen is usually marketed in combination with one drug that we call it non-steroidal anti-inflammatory drug, that is phenazone. So diaminogen aceturate is coming in combination with phenazone. Phenazone is the non-steroidal anti-inflammatory drug that is reducing the inflammation as well as the pain, in inflammation as well as the pain. And mainly we are going to administer this diaminogen aceturate parenterally, either subcut or intramuscular injection. Regarding this, when we are administering this diaminogen aceturate in dog at multiple administration, as a multiple administration, then diaminogen aceturate on multiple administration in dog will produce severe nervous sign. So here we have seen equine and dog. Be cautious to use in equine, that because of the local reaction and the hypoglycemia. In dog, it produces the nervous sign. So this is about the causes or side effect associated with the diaminogen aceturate. Regarding diaminogen aceturate utility is concerned, the drug that we already discussed is used to treat trypanosomiasis, used to treat babesiosis. So babesiosis is coming under the pyroplasmosis, and species are for camel, cattle, dog, cats, sheep, horse, and swine. Not cat, dog, goats, sheep, horse, and swine. And interestingly, that earlier we have not mentioned about this point. Here I have to mention this diamina aceturate is not effective against the trypanosomiasis, that in later stage or late stage. So this is very important point that we already discussed in earlier, that this drug about the diaminogen aceturate is that diaminogen aceturate is not effective in late stage of the trypanosomiasis, not in early but late stage. So therefore be careful to think about this treatment. So the dose of the diaminogen aceturate is concerned for the trypanosomiasis is for dog 7 mg per kg intramuscular once, and if required you have to repeat it after 2 to 4 weeks. Then for cattle, this the dose is 3 to 3.5 mg per kg IM or subcut, and particularly for the species Trypanosoma brucei that we already discussed, brucei is somewhat less effective. Diaminogen aceturate is less effective against the Trypanosoma brucei. So making it more effectiveness, we are going to increase the dose of the diaminogen aceturate in cattle. Just we double it, that is 7 mg per kg body weight intramuscularly or subcut. So this is about the diaminogen aceturate. Next drug is phenamidine isethionate. This phenamidine isethionate is trypanocidal as well as anti-babesial drug. So phenamidine also act against both the species Trypanosoma as well as the Babesia. And here one important point is that the drug phenamidine isethionate is showing even good efficacy against the Trypanosoma brucei and Trypanosoma evensi. Why? What the goodness in this phenamidine isethionate? As we discussed, diaminogen aceturate is showing less effectiveness against the Trypanosoma species brucei as well as evensi. But the drug, or however the drug phenamidine isethionate is showing very good efficacy against the brucei species and evensi species. So therefore we have to use the combination of diaminogen aceturate and phenamidine isethionate and making it a good combination to act against this drug, this species Trypanosoma brucei and evensi, or it is better to use singly phenamidine isethionate because both the drug belongs to the same group, so it is better to use alone. We have to take the drug from the other group. So phenamidine isethionate is showing good efficacy against the brucei and evensi species of Trypanosoma on which diaminogen aceturate is less effective. The two drugs stilbamidine from the same group diamidines or aromatic diamidines is stilbamidine and pentamidine that we already discussed. These two drugs are particularly showing efficacy against the Trypanosoma, but the efficacy is the less as compared to the two earlier we have discussed. So this stilbamidine and pentamidine are showing less efficacy against the trypanosomiasis as compared to diaminoaceturate, and so therefore this is the reason these two drugs are less in use for veterinary purposes. So this is about the first group that we have finished, that is about the aromatic diamidines or simply diamidines. Next group is quinapyramine compound. What is important about the quinapyramine compound is that there are two salts is available, quinapyramine chloride and quinapyramine sulfate. Quinapyramine sulfate or quinapyramine chloride is concerned, chloride is less soluble in water, that is the sparingly soluble in the water, whereas the sulfate is showing good solubility in the water. And because of this property, their activity are different. Quinapyramine chloride is less soluble in water, and it will absorb slowly, and therefore it will act for longer time interval, and because of that we are using chloride salt as a prophylaxis measure, whereas the sulfate salt is having good solubility in the water, better absorb, early absorb, and therefore we are using this drug for the therapy purpose, that is the quinapyramine sulfate. So here about and this drug is quinapyramine chloride and the sulfate are used for the treatment of trypanosomiasis as a prophylaxis and therapeutic purposes respectively. As we earlier mentioned, chloride is less soluble in water or sparingly soluble in water, therefore it absorbs slowly, and therefore it is long acting, and because of that we are using as a prophylaxis and showing the strong prophylaxis action, whereas the sulfate salt, that is also called methosulfate, is not very good showing the very good solubility or freely soluble in the water, therefore this drug is fastly or rapidly absorbed and therefore short acting, because its therapeutic concentration gets rapidly reduced from the blood, and therefore it is short acting, but it is mainly used for the treatment purposes. This salt is coming in combination, that is the quinapyramine sulfate and quinapyramine chlorides, and this combination ratio is 3:2. 3:2 ratio. Sulfate is 3 part and the chloride is 2 part. Why the sulfate is more? Because it absorbs fastly, it absorbs because of its solubility, and this combination we call it entry side pro salt. So what is entry side pro salt? Is the combination of quinapyramine sulfate and quinapyramine chloride in the ratio of 3:2, and one sulfate is for the therapy purpose, whereas the chloride is for the prophylactic measure, and as both the combination of chloride and sulfate are showing the complementary effect against the trypanosomes. Now we have to go through the mechanism of action of the drug quinapyramine sulfate. So similar to the earlier drug that we already mentioned in the diamminazine, they are also targeting the DNA. So quinapyramine is also showing the action on the DNA. They produce the condensation of the DNA, as well as it also cause effect on the ribosome, so therefore it leads to the loss of ribosome of the susceptible protozoa. So quinapyramine chloride and sulfate are actually trypanostatic, and because of its nature trypanostatic, the drug require host defense mechanism to inhibit the growth of the final killing of the protozoa. So therefore this quinapyramine is the trypanostatic in nature, therefore it requires host defense mechanism. Regarding its sensitivity to species is concerned, against which species of trypanosoma drug is more active. So quinapyramine is showing good efficacy against Trypanosoma congolens, Trypanosoma evensi, Trypanosoma vivax in the species like cattle, horses, camels, and dog, whereas it is less effective against the Trypanosoma bruegei, similar to the quinapyramine diaceturate. The quinapyramine is also showing efficacy against the species like Trypanosoma equiperdum and equinum. So this is about the susceptibility of the drug against the Trypanosoma species. Regarding some point of pharmacokinetic is concerned, it is not well absorbed or not absorbed orally, so therefore the drug quinapyramine is available as parenteral administration. What is the important about this quinapyramine is that the quinapyramine is going to produce the problem at the site of administration of drug, particularly in a species horse. So therefore for the horse, because quinapyramine is going to produce localized pain, inflammation and sloughing of the tissue, we have to use this quinapyramine for the horse as a solution strength 5%. So 5% solution strength we have to use the quinapyramine in horse, or to avoid the problem of this localized pain, inflammation and sloughing of the tissue, we have to take two or more than two sites, so that its effectiveness as a pain, inflammation and sloughing of the tissue get lessened. And for the other than horse, we use the solution as a 10% solution. So quinapyramine we have to use both as a 10% as well as the 5%. So 5% is the for the administration of the drug for the horse, whereas in the other species we have to use 10% solution of the quinapyramine. Quinapyramine is used, as we already discussed, for treatment as well as the preventive measures for trypanosomiasis, and the dose in the cattle and other species is 10% solution subcut in neck or dewlap region, and we have to massage the site after its administration of quinapyramine, as well as for the horse 5% solution intramuscularly we have to use. For the cattle and other species we have to administer 10% subcut, and this the dose rate is concerned, this is the strength of the solution. Dose rate is concerned for the cattle, horse and other species. The dose rate we have to consider as per the body weight. So less than 150 body weight, the dose is 4.4 mg per kg body weight. If this is 150 to 200 kg body weight, we have to use the total dose 1 gram. If 200 to 350 kg body weight of the animal, we have to use total dose 1.5 gram, and other than more than 350 kg, this you have to correct it. If the weight is more than 350 kg, we have to use 2 gram more than total dose 2 gram, not more than total total dose 2 gram. Now we have to go through the next anti-trypanosomal group, that is the aminophenanthridium compound, and the example that we already discussed: homidium, isometamedium, pyrithidium, dimedium. This homidium and isometamedium are less toxic, and therefore we are using this more for the veterinary use. So now we have to go through the homidium. Homidium is also known as ethidium. Homidium is also known as ethidium. So this homidium is coming in two salts, that is homidium hydrobromide and homidium hydrochloride. This homidium hydrobromide dissolve in about 20 part of the water as compared to the drug amount, whereas hydrochloride is soluble in 5 part of the water, that is weight by volume, and the homedium is showing activity against the different species of the trypanosoma are Trypanosoma congolens, Trypanosoma vivax, and the species are in cattle, sheep, goats, and horses. This similar to the diaminogen aceturate, homedium is also less active against the brucei and evansii. So this is interesting. And regarding evansii, the homedium is rather inactive, not active, but it is less active against the brucei, Trypanosoma brucei. And usually homedium is not given biorally, that earlier drug from the two group that are also not going to be administered orally, they are coming in the parenteral preparation. So likewise homedium is also for the parenteral administration, particularly deep intravascular as a single dose, and this or we have to use also as a subcut, but in subcut administration it may leads to severe localized reaction. So preferably or primarily we have to use homedium as a deep intramuscular single dose administration. Regarding its mechanism of action is concerned, as similar to the previous group, this is going to bind with the DNA, and when this is going to bind with the DNA, so it will interfere in the DNA synthesis, as well as it also affect the energy system, that is the glycosomal function. So glycolysis pathway, as well as in addition, this is also influence the cell division of the susceptible protozoa. So not only the drug homedium is going to bind with the DNA and therefore interfere the function of DNA, as well as it also act on the glyco energy production system, that we call glycolysis pathway, and as well as it affect the cell division because it influencing the replication of DNA, and therefore it will influence also the cell division. Regarding its use is concerned about the homedium, this is used both for the treatment and prophylaxis measure for the trypanosomiasis, like the quinapyramine, chloride and sulfate, and the species for which the drug is using are for the cattle, sheep, goats and horses. The dose is 1 mg per kg as a deep intramuscular administration. Next drug from the same is the isometamedium. Isometamedium is also called metamedium and also called trypanmedium, isometamedium and metamedium chloride. This drug isometamedium is showing activity against the Trypanosoma species congolens, then Trypanosoma species vivax in the species like cattle and horses, and this drug is also showing activity against the evansii, that we already same homedium is showing no activity against the Trypanosoma evansii. However, this isometamedium is showing activity against the Trypanosoma evansii in the species like cattle, buffalo and camel, and it is slowly absorbed from the intramuscular administration side. Regarding its mechanism of action, this is maybe the similar to the group, but again we are going to go through the more about the mechanism of action of this isometamedium. So isometamedium is modifying the membrane, mitochondrial membrane, as well as it also modify the glycoprotein structure of the endoplasmic reticulum, that particularly the membrane. Isometamedium, so this is about the mechanism of action. Isometamedium is used for both treatment and prophylaxis of the trypanosomiasis. And interestingly, this isometamedium is its prophylaxis activity is showing activity up to 2 months or more. So we have to administer this drug after the first dose administration of after 2 months of administration of the first dose as a prophylaxis protection. Isometamedium, as this is showing the low safety of margin, and at the site of administration it produces the pain, swelling and necrosis of the tissue at injection site. We are going to administer this drug along with the IV fluid dextran. So isometamedium we have to administer or mix with the dextran, and we have to intravenously drug has to be administered. So for the treatment of trypanosomiasis, isometamedium dose for the cattle and horses is 0.5 mg per kg deep IM as a single dose, and for resistant cases the dose may increase to 1 to 2 mg per kg body weight. As a prophylaxis measure that we already seen that it will produce its efficacy up to 2 or more months, and the dose for prophylaxis measure for trypanosoma against the trypanosoma is in the species like cattle and horses, the dose is 2 mg per kg deep intramuscular administration. Next, from the same drug, from the same group is the group is called aminophenanthridium, and the last two drugs from the aminophenanthridium is pyrithidium and dimedium. So pyrithidium is showing activity against the species of Trypanosoma vivax and congolens and brucei. So good efficacy against the brucei also. And the drug pyrithidium should be administered by the intramuscular route or subcut route as a prophylactic agent, and this drug as a prophylaxis measure showing its efficacy up to 6 months. So this is important, and this one is for the single administration. Regarding its, so that therefore pyrithidium we have seen is used mainly for the prevention of the trypanosomiasis, and the dose is for cattle and horse is 2 mg per kg intramuscular or subcut administration. And the last one is the dimedium, and this is showing efficacy against the congolens, and dimedium is coming in form of bromide, dimedium bromide, and this is showing effectiveness against the trypanosoma congolens, whereas the less efficacy against the trypanosoma vivax and rather inactive against the brucei and Trypanosoma evensii. So this is about the dimedium, and the dose for the cattle and horses is 1 to 1.5 mg per kg as a 1% aqueous solution deep intramuscularly. So this is all about the aminophenanthridium. So in aminophenanthridium there are two important drugs are homedium, then isometamedium, and you may incorporate these two. If you are going to recall these two from this group, then it is very good. So aminophenanthridium drug which include that I already mentioned. Now we have to go through the next group about the anti-trypanosomial drug is group carbamide derivative, and the example is only one drug, suramine. So this suramine is used for both curative and prophylaxis measure. No doubt aminophenanthridium drug is also used for both curative as well as the prophylaxis measure, but some may have some of the drug may have both the activity, I mean prophylactic as well as the treatment purposes, that we have already seen, like homedium that is called also ethidium, that is for both the purposes, treatment and prophylaxis. And earlier also diamminazine chloride and aceturate is showing also curative as well as the prophylactic measure. And also the first group diamminazine is also for both the purposes, that diamminazine aceturate is for both the prophylactic as well as the treatment purposes. We have to use this diamminazine aceturate, but mainly the treatment purposes we have to use. But we have also mentioned hereby to mention one point that trypanosoma is this diamminazine aceturate is rather very less effective or no effective against the late stage of the trypanosoma. So this is important point about the diamminazine aceturate. Now we have to go through the other group that are carbamide derivative, and the only one drug is there, that is surramine. And the mechanism of action is this drug is concerned, the drug is going to, when bind with the protein, particularly the plasma protein of the host, and it will reach to the enter to the trypanosoma, and there surramine get released. And once the surramine get released in the trypanosoma, inside the trypanosoma is going to act on the trypanosomal enzyme like serine, oligopeptide or some more enzyme, as well as surramine also damage the intracellular membrane structure of the trypanosoma, and therefore it is trypanocidal activity. So this is about the surramine mechanism of action. So main mechanism of action is to bind to the plasma protein of the host, reaches to the trypanosoma, within the trypanosoma, get freed in the trypanosoma, and therefore freed surramine is going to act on the enzymes of the trypanosoma like serine oligopeptide and hindered its function, as well as it also damaged the membrane intracellular membrane structure. It may be of the organelle, and therefore it killed the trypanosoma. And the efficacy is concerned, showing the good efficacy. Surramine is showing good efficacy against Trypanosoma evensi, Trypanosoma brucei, Trypanosoma equinum, and Trypanosoma equiperdum. And Trypanosoma against the surramine is showing no activity against the Trypanosoma congolens, Trypanosoma vivax, and Trypanosoma simii. So the drug is also showing very good activity against the African trypanosomiasis, which lead to sleeping sickness in human being. So the surramine is also showing very good efficacy against the African trypanosomiasis, and the species are Trypanosoma brucei gambiensis, Trypanosoma brucei rhodiensis, and which is called leads to African trypanosomiasis, and the condition is called sleeping sickness in human beings. So for human being, the surramine is also to be used for the therapy of African trypanosomiasis. It is only administered by intravenous route. Surramine is only administered by intravenous route because orally it is not absorbed, and when we have to administer through the parenteral administration like subcut or intramuscularly, it produces severe localized reaction in as well as the tissue necrosis at administered site, and therefore we have to be use this drug as a intravenous route. The side effect is concerned, this drug is showing toxicity against the horse and donkey. So we have to be cautious to use surramine in two species, horse and donkey, because this is toxic to the horse and donkey, where the camel is showing resistance against this drug surramine. And as we earlier also have seen, one drug that the percentage of that drug we have to use as a 5%, and the drug that was the quinapyramine. So quinapyramine For the horses, we have to use 5%, whereas the surramine we have to be cautious or not have to be used for the species like horses and donkey because they are highly susceptible or toxic to this species, whereas camel is resistant to the surramine. And the drug should not be administered in surramine sensitive patient. Regarding its synergistic action is concerned, surramine is showing synergistic activity with the phenanthridium compound like homedium and isometamedium. Therefore, we may have to use in combination to produce synergistic effect with the surramine. Regarding its use is concerned, we already have mentioned it is also used as a African trypanosomiasis treatment in human being, and it is the surramine is also used for both curative and prophylaxis measure for trypanosomiasis in animals. And the one important point is that about the one more important point with the surramine is that surramine is once you have prepared it, you have to administer it because drug drug is unstable in air. So therefore, once we have prepared the surramine, we have to use it because it is stable in the air. So for the treatment purposes, we have to use in cattle 12 mg per kg slow IV. For the horse, 7 to 10 mg per kg slow IV. And this dose may be repeated up to three times at weekly interval. In camel, the dose is 8 to 12 mg slow IV. And one important point here we are going to discuss what is pre-immunity. What is pre-immunity? This is also known as pre-immunity or pre-immunity, you may pronounce it pre-immunity or infection immunity. So name is telling something that this is in case of protozoa and in some rickettsia, if the very meager quantity of protozoa is existing in the host, this will lead to the development of immunity against that particular protozoa which is residing in the host. So, very meager quantity of the protozoa, if residing in the host, it will develop the immunity against that particular protozoa which is residing in the host is called pre-immunity or infection immunity. Means ki infection is there and that infection is going to produce the immunity. So when there is infection occur with the large quantity of the protozoa get entered in the animal, then this pre-immunity is going to save the animal. So immunity to a particular infection due to previous presence of causative agent is called pre-immunity or progressive development of immunity in individual exposed to infective agent of like protozoa and rickettsia is called pre-immunity. So some of the drug that particularly when we are going to use for the Babesia, that some of the drug they are not going to kill all the protozoa. Some of the protozoa is still remain persist in the host, and that some number of protozoa that persisted and not killed and that remain intact in the host animal is going to produce the pre-immunity against the Babesia for the particular drug that we are going to discuss thereafter the finishing this anti-trypanosomal drug. In the anti-trypanosomal drug, antimonial compound, which is not very much in use because of the low safety of margin, and we have better choice, so we don't have to use. And the dose for this antimonial potassium tartrate, that is tartar emetic, for cattle and horse is 3 to 5 mg per kg slow IV. For dog and cat 1 to 3 mg per kg slow IV. For stibofen sodium, this is also rarely used because of the adverse effect, but the dose for the dog is 30 to 50 mg per kg IV or subcut once, may repeat in 24 hours if required. Next is the last one is the under the anti-trypanosomal is the dyes. Under the dyes, the two dyes are there, trypan blue and the trypan red. That is also not used and not to be used, but this is also the drug for the trypanosoma, for the treatment of trypanosoma, and no longer we are going to use this. So this is all about the anti-trypanosomal drug. Now we have to go through the drug that we have to use to treat the pyroplasm, and therefore we call it the anti-pyroplasmal drug. So what is anti-pyroplasmal drug? It means the pyroplasma, pyroplasmia is a subclass, and from this subclass pyroplasmia, the three species are usually present: the Babesia, Theileria, and Cytauxzoon. And these three species, because they belongs to pyroplasmia, and because its shape pear like shape, we call it the pyroplasma, and the disease is transmitted by the ticks. Now actually these parasites, or you can say the protozoa, is blood parasites. Now we have to go through the classification of the anti-pyroplasmal drug. So now we have to start with the anti-pyroplasmal drug. So first we have to define. So the drug that are used to treat the disease produced by the species like Babesia, Theileria, and Cytauxzoonosis are called anti-pyroplasmal drug. And the drugs that are classified under anti-pyroplasmal drugs are diamidine derivative or diamidines. That diamidine derivative again subdivided into two types: carbonylide diamidines and aromatic diamidines. Regarding aromatic diamidines is concerned, we already knowing about the example diamidine aceturate, pentamidine, phenamidine. And another group from the same diamidine derivative is carbonylide diamidine. And the drug are imidocarb and amicarbolide. Next group is quinuronium compound. And the salt is quinuronium sulfate. So this is the another drug that we have to use for the treatment of pyroplasma. It may be the Babesia, Theileria, and Cytauxzoons. Next group is the naphthoquinones, and from this group, the example that are mainly used for the Theileria are parvaquone, buparvaquone, and atovaquone. They are very much used for the treatment of Theileria because they are costly drug. This next group is 8-aminoquinolines. 8-aminoquinolines examples are primaquine, and next drug is group is the tetracycline, and the drugs are oxytetracycline, chlortetracycline, and doxycycline. This is the antibiotic group. Then quinazolines. This quinazoline example is halofuginone. This halofuginone is specifically the drug for anticoccidial that we already discussed in anticoccidial, but still we are using it also for the pyroplasma. And the next and the last is the ditrypan blue that we are going to discuss the drug about one by one. So the first one is the diamidine derivative. Under this, the first group is carbonylide diamidines, and the example is imidocarb and amicarbalide. Imidocarb, first we have to discuss from carbonylide group. Imidocarb is used for the species to treat are for the Babesia, then Anaplasma and Erlisiasis. So the treatment of Babesia, Anaplasmosis and Erlisiosis, we have to use the imidocarb. Regarding its mechanism of action is concerned, the similar to the aromatic diamidines, they are going to combine with the DNA of the susceptible protozoa, and therefore it interfere in the synthesis of DNA synthesis process. So it will interfere in the DNA synthesis process. In addition to that, imidocarb is also going to produce vacuole within the cytoplasm of the protozoa. So vacuolation we call it. So it inhibits the DNA synthesis as well as it produces the vacuolation in the cytoplasm of the susceptible protozoa. Regarding its activity is concerned, that we already mentioned, it acts against the Babesia, Anaplasma, Cytauxzoon, Hepatozoons. The drug imidocarb is showing good efficacy against the species of Babesia canis, Gibsoni for the dog, Babesia cavalli for the horse, and showing poor activity against the species of Babesia in cat. The drug we already mentioned ki this is acting against the Anaplasma in cattle and Erlisia in dog. Now we have to go through the some more point about the imidocarb. Imidocarb, after its single administration, is showing sufficient anti-protozoal activity for several weeks, that is more than 4 weeks. So its efficacy of imidocarb even persists for several weeks, that is more than 4 weeks. Regarding side effect is concerned, because of its low therapeutic index, after the administration of the dog, they are going to produce the vomission in the dog and also showing cholinergic sign. That is the very important. And one more important point about the imidocarb is that about cattle, when we have to administer the cattle in imidocarb in the cattle at the dose rate of 10 mg per kg, then it may leads to the death. So be cautious about the dosage for cattle, and this drug to be contraindicated in any species who is patient of the liver or renal, and because it will persist, imidocarb will be remain reside in the tissue for about 170 days. So therefore imidocarb should not be recommended for the food producing animal, and imidocarb must not be administered by IV route. So IV route must not be administered, whereas one drug that belongs to anti-trypanosomal, that is the suramine, that is specifically administered by this route IV with the dextran, whereas this imidocarb should not be administered IV. So this is the difference between the drug you have to keep in mind. This drug imidocarb, because this is showing the cholinergic effect, cholinomimetic type of effect, so therefore we don't have to use this drug with the pesticide or anti-cholinesterase agent. Imidocarb is used for the treatment as well as the prophylaxis measure of the Babesia in cattle, sheep, horses, and dog. And also we have to use for the anaplasma and in cattle and ehrlichiosis in dog. It should be administered by the subcut or intramuscular, but never imidocarb has to be used through IV route. Then its dose for the Babesia treatment in dog 5 mg per kg IM or subcut. For cattle 1.2 mg per kg subcut. For sheep 1.2 mg intramuscular. For horse 2 to 3 mg intramuscular. As a prophylaxis use of imidocarb, we have to administer for babesiosis in cattle. The dose is 3 mg per kg subcut as a single dose. For anaplasmosis in cattle, 3 mg per kg subcut. So this is about the imidocarb. Next drug from the same group is that is the carbonylides diamidines, that is the carbonylides diamidines is amicarbalide isethionate. So amicarbalide isethionate is used to treat bovine babesiosis, and the species sensitive with this amicarbalide isethionate is Babesia bigemina, Babesia argentina, and Babesia bovis. Amicarbalide isethionate is also showing efficacy against Babesia cavalli in horses and showing activity against the Babesia equi in horses. But amicarbalide isethionate is not showing or less showing less activity against the Babesia canis in dog. So less activity of the amicarbalide isethionate in dog. The species is Babesia canis. The amicarbalide is not effective against the Theileria. So this is important point about the amicarbalide isethionate. And one more point is that amicarbalide is going to produce the pre-immunity. That is the a type of immunity that we already discussed about the treatment. So this is primarily used to treat the babesiosis in cattle, and we may use as a pre-immunity, and we have to administer to produce pre-immunity in cattle at the height of the temperature. So when the temperature at peak, at that time we have to administer this amicarbalide isethionate. And therefore, this amicarbalide is not going to eradicate the parasite completely. So some of the parasite remain present in the host, and that some number of the parasite is going to produce the immunity. So therefore, this is called pre-immunity. And for the side effect is concerned in the horse at high dosage, it produces some necrosis of the liver and kidney and local swelling after the subcut administration. So therefore, we may administer it by the slow IV. For Babesia treatment in cattle, the dose for the amicarbalide isethionate is 5 to 10 mg per kg body weight IM subcut. For horse 8.8 mg per kg IM. And next group is from the same diamidine derivative is aromatic diamidines. In that we already discussed about the diaminazine aceturate in the anti-trypanosomal drug. So this one is also used for the anti-trypanosomal drug. So the drug is acting also against the Babesia. So the drug is used for Babesia and Trypanosoma. About this drug, we already has been discussed, but again we are going to repeat it. So for the Babesia, the species susceptible with the diamine aceturate are Bigemina, Babesia equi, Babesia cavalli, Babesia canis, Babesia gibsoni, Babesia herpilurea, and the species are bovine, equine, canine, and feline respectively. And diaminagene aceturate followed by imidocarb treatment helps to eradicate Babesia, particularly from the dog, the species Babesia canis. So if you want to remove the complete removal of the Babesia canis, then you have to use first diaminagene aceturate that we have already seen. This diaminagene is imidocarb is imidocarb is showing poor activity against the dog babesia. So therefore, we have to give this drug. No, Babesia canis showing good efficacy. Imidocarb is showing good efficacy against the Babesia canis. So imidocarb is showing good efficacy against the Babesia canis, whereas this diaminogene aceturate, where is diaminogene aceturate? So diaminogene aceturate is also acting against the Babesia canis, and therefore to eradicate Babesia canis from the dog completely, we are going to combine these two drugs, diaminogene aceturate and imidocarb. For the treatment of Babesia in dog, the dose for the diaminogene aceturate is 3.5 mg per kg subcut. For the cat, 2.5 mg per kg subcut. For the cattle and horses, 3 to 5 mg per kg IM. For the horse, it is for the horse and for the same in the same animal for the species equi, the dose should be double, that is the 6 to 12 mg per kg for the species Babesia equi. Next, from the same group, aromatic diamidines is pentomidine isethionate. So this pentomidine isethionate, the drug is showing good activity against the Babesia as well as Trypanosoma. However, the diaminogene aceturate is also acting against the both Babesia and Trypanosoma. And this pentomidine isethionate is also showing pre-immunity, development of pre-immunity in the animal cattle. So therefore, when we are using pentomidine isethionate in cattle, it will not eradicate the Babesia completely, and therefore it will leads to the development of pre-immunity. And the another drug like the pentomidine, which one is going to produce the pre-immunity? That is the amicarbalide isethionate. This is actually isethionate. This is spelling isethionate. We have to see the check this ISO. So isethionate. So the drug pentamidine isethionate is acting for the Babesia and Trypanosoma, also uses a pre-immunity, and the drug should be given at the height of the temperature to develop the pre-immunity, and after that the drug will not completely eradicate the protozoa, and which will lead to the development of the pre-immunity. And this pentomidine isethionate is also showing the activity against the leishmaniasis. So the pentomidine isethionate is also acting against the leishmaniasis. So for the dose for dog is 16.5 mg intramuscular, for cattle 0.5 to 2 mg per kg subcut. Next from the same group is phenamidine isethionate. This phenamidine isethionate is showing good efficacy against the Babesia species in the animal like cattle, horses, and dog, and administered by subcutaneous administration. The dog in dog, the dose of the phenamidine isethionate should be repeated after the first dose of administration or 5 to 6 days after, and which will help to irrigate the canine babesiosis. So this may be used for the phenamidine isethionate may be used for the treatment of eradication of canine babesiosis. The dose for the cattle and horses is 0.03 ml per kg as a 40% solution and 5% solution for the dog, and the dose is 0.3 ml per kg. So this is about the diaminazine. This is from the aromatic diamidines. So this we already discussed about the all the drug. Next group is the quinuronium compound. The drug is in form of sulfate. So quinuronium sulfate we have to use, and this drug is used for treatment of babesiosis of a species Babesia bovis, Babesia bigemina in cattle, then Babesia ovis and Babesia motasi in sheep, Babesia cabali in horses, and Babesia canis in dog. So this quinuronium sulfate has to be used for the babesiosis, and this quinuronium sulfate is primarily used for pre-immunity in endemic area of the babesiosis. Like that we already discussed, pre-immunity is also going to develop by the drug like the pentamidine isethionate, and the another is the amicarbalide isethionate. So amicarbalide isethionate, then pentamidine isethionate, and then the quinuronium sulfate is going to produce the immunity against the protozoa, that we all going to call it the pre-immunity. And so therefore, that here is also written amicarbalide isethionate and quinuronium sulfate is used as to control the Babesia by giving the pre-immunity. And this drug, quinurium sulfate, has not to be repeat after has to be has not to repeat for at least 2 weeks, and thereafter about 3 months we have to may repeat it. Quinurium sulfate, quinuronium sulfate as 5% solution we have to use in cattle, horses, and pig by subcut, and quinuronium sulfate as 0.5% solution we have to use by same route subcut in sheep and dogs. So this is important about the quinuronium sulfate as 5% solution and 0.5% solution depending on the species. For the treatment of cattle and sheep and pig for the babesiosis, we have to use the dose 0.5 mg per kg subcut. For horse, 0.3 to 0.5 mg per kg subcut. For the dog, 0.25 mg per kg. Dose is quite similar for all these species, which is ranging between 0.2 to 0.5. Next group is naphthalene. From that, the drug are parvaquone, buparvaquone, and atovaquone. These parvaquone and buparvaquone, both the drugs are specifically used for the treatment of theileriosis. And the drug is buparvaquone is quite costly. So be cautious to use it, because if the species is not the Theileria, and if you are using, then you are only spoiling the drug. So the drug belongs to naphthoquinones are parvaquone, buparvaquone, and atovaquone. And the mechanism of action is again, the drug is going to act on the energy system of the parasite, that is the mitochondrial electron transport system of the parasite, and therefore it interfere in the ATP synthesis, as well as it also interfere in pyrimidine synthesis of the susceptible protozoa. And as you know, this pyrimidine is the nitrogenous base. So this is the way, this is the, and therefore finally it may inhibit the synthesis of ATP, so no energy for the susceptible parasite, as well as the no genetic material to propagate, to participate in the cell division. Parvaquone is a synthetic naphthoquinone derivative used for the therapy of theileriosis in the cattle. So this is important. Regarding mechanism, that is the same mechanism is mentioned here, that acting on the energy system. So the drug is used to treat the theileriosis in cattle. So for the dog treatment, the dose for the pyroplasmosis, particularly theileriosis, is the 20 mg per kg subcut. For the cattle, also 20 mg, but the route is IM as a single dose. Buparvaquone is concerned, the dose for buparvaquone is for both therapy as well as the prophylactic measure for all form of theileriosis in the cattle. The dose is the dose for the cattle is 2.5 mg per kg intramuscular as a single dose. As the drug is having very good half-life, so the drug is remain for therapeutic efficacy for longer time, that is 7 days. Next is the atovaquone. Atovaquone is the drug is particularly used for the malaria treatment, but also for the toxoplasmosis, as well as when atovaquone is going to use along with the antibiotic azithromycin orally, then this may be having showing efficacy against the Babesia. So this we have to use the atovaquone along with the administration of azithromycin orally to treat the Babesia and also to treat the toxoplasmosis. So the dose of atovaquone for toxoplasmosis in the dog is 15 mg per kg orally daily for 3 weeks. Next is the 8 aminoquinolines, and the drug is primaquine. This primaquine is also anti-malarial drug, but also has to be used as to treat the babesiosis, particularly in cats. So this is very, very important. Primaquine is rather anti-malarial drug for human being, and its phosphate salt, primaquine phosphate, is going to use for the treatment of babesiosis of the cat species, that is the Babesia felis. So we have to use Babesia to treat the babesiosis, that is the Babesia felis. And the mechanism of action is concerned, we have seen that the majority of drug either acting on the DNA or energy system. So likewise, this is also going to act on both the pathway. It is inhibiting the function of DNA, as DNA of the susceptible parasite or protozoa, as well as it also affect the energy mitochondrial energy system, and therefore it will influence the ATP generation, and therefore it will going to affect the going to kill the Babesia. And this primaquine is an anti-malarial drug which also leads to the hemolytic anemia, because it leads to the deficiency of one enzyme, glucose 6-phosphate dehydrogenase, which is required to mature the erythrocyte. So because of the deficiency of the erythrocyte, because of deficiency of the enzyme glucose 6-phosphate dehydrogenase in the host, which leads to the hemolytic anemia in the host. So the drug is available in the parenteral administration, and after its parenteral administration it also produces the hypotension. The treatment for babesiosis in cat and dog also, the dose is 0.5 mg per kg orally or IM dose, and dose may be toxic for the cat if we increase the dose up to 1 mg per kg. So dose is very much important for the species. Next, and next two three group is left, that is the tetracycline. Under the tetracycline antibiotic group, three drugs we are going to use for the Babesia as well as the Theileria: oxytetracycline, chlortetracycline, and doxycycline. Along with the action against the Babesia, it also showing activity, mainly the activity against the bacteria. So this is an antibacterial agent. So oxytetracycline we have to use for the treatment of Babesia, particularly the species Babesia divergens in bovine, and particularly uh, oxytetracycline long acting we have to use to treat Theileria also. But for the treatment of Theileria we have to use this drug in cattle for longer time interval as well as the at higher dose. The other antibiotic from the tetracycline is the chlortetracycline, and the species susceptible with this drug is the Babesia equi in the animal equine, and the doxycycline is for the dog babesiosis, Babesia canis. So this is all about the tetracycline. Next we have to go through the quinajolines. From that, the drug is halofuginone. What is important about the halofuginone? Halofuginone is the drug is primarily used against the anticoccidia or against the coccidia, and this halofuginone is also showing good efficacy against the Theileria. So Theileria in the cattle. So because the parvacone or buparvacone is the costly drug, so we may have to use other drug also which is less costly. So halofuginase is not much costly but highly potent drug, and the drug is for mainly for the coccidia. So for bovine theileriosis, we have to use the halofuginone. And the treatment of theileriosis dose for the cattle is 1 to 2 mg per kg orally as a single dose. And the last one is the dyes. In that we are going to use trypanosoma, but because of its toxic effect, we are not going to use to treat the babesia. And also it will stain the milk and tissue, so we don't have to use this drug. And also because it is extra, it should be administered by the IV, and when there is extravasation of the drug will occur, it will lead to the localized irritation and tissue sloughing. So therefore, because of its side effect, I mean the toxicity, because of its extravasation, we have to avoid, we have to better choice, so we have to use. And the dose for dog is for 1% solution